at Central Kansas Mental Health Center. I came on board as one of their psychiatrists who had been there for many years, was retiring. I believe one of the issues that led them to choosing telepsychiatry was that they had tried for a long time to recruit somebody to the site itself, and as of the time of her retirement, they didn't have anybody. And I think they turned to telepsychiatry, as they had been actually working with telepsychiatry for some time at that point, for a full-time provider to take over the caseload of the retiring psychiatrist. I think one of the advantages of telepsychiatry in general, and then also for Central Kansas Mental Health, was that they were able to get me in quite a timely manner. The state of Kansas actually moved my license forward there pretty quickly, and I was able to fill in right at the time of her retirement, so there was not a gap in treatment for the patients, and it didn't overly burden the other providers who were either on site or providing telepsychiatry services at the same time. I think one of the other things that they were looking for was something that was also cost effective, as we all are. I think everybody knows that it is expensive to recruit a physician. There's a lot of cost involved to maintain that physician, and I think that telepsychiatry services are able to do that, again, in a very cost effective manner. A typical session for my patients in telepsychiatry is actually very similar to a session that they would experience if we were meeting face-to-face. The patient is brought into the room by one of my staff, and they meet with me, and really it's the same interaction that they would have if I were there in person. My session is conducted entirely the same. The examination, the interview, everything is very, very similar. I do typically get a lot of positive feedback. I get more positive feedback than I do negative feedback, as a matter of fact. I think the best way to describe it is patients say that they're pleasantly surprised. One of the more interesting points of feedback that I've gotten, and I've actually got it a few times, is that people forget that they've never met me in person, that they seem like they do actually know me, as if, you know, they had met me one-on-one, and they forget that I'm, you know, several thousands of miles away. I think that they feel like they're getting just as good care, and many have reflected that they felt like they've gotten better care than some of the other providers that they've met, which has been very encouraging, because I do know that it can be a hurdle for them to get used to doing this through technology. So I do think telepsychiatry can be beneficial for a variety of treatment settings, but in particular when thinking about a community mental health center, I think by far and away the biggest need that it addresses is the physician shortage. I think, as everyone is very much aware, there are not enough physicians to meet demand, specifically psychiatrists. There aren't enough of us to go around, unfortunately, and I think rural areas really feel that more, although urban areas most certainly are not excluded from it. I think it's very difficult to recruit a physician. I think it's even more difficult to recruit a physician that's the right physician for your treatment setting, for your particular organization. And I think that telepsychiatry really can help with that, not just getting a physician in there, but getting a physician in there in a timely manner, and the psychiatrist that is right for your organization. I think getting services in a very time-efficient manner is even more important. I know that just anecdotally, I've seen several community mental health centers going years without a provider, which really burdens the other providers who are in the clinic itself. Luckily, of course, we have mid-level providers who are able to fill that need, but as we all know, you do need a physician in a lot of these settings, and they can't wait. The patients can't wait, the organization can't wait. So I think this is a great way of doing it.